What do we know about testing? Are enough people being tested in the US right now? And will the number significant increase in the next 30 to 40 days?
I think the hope is that the numbers will increase in the next 30 to 40 days, but I think we just don't know yet. We have a lot of tests in the United States, but unfortunately I think they're not distributed in a way that allows us to do systematic and broad testing. And that testing is sort of the linchpin of all the other public health measures that we're putting into place. So we definitely need to ramp up testing, and we need to make sure testing is happening in these hardest hit places.
How do you see the lockdown ending? So do we just return to normal, or will there be very specific health measures of social distancing that need to be kept?
It's a great question. I think, everyone's looking forward to the lockdown ending, but we have to do it carefully or we'll be back right in this situation or possibly even worse after we reopen everything. Testing is going to be critical to ending this lockdown, and then you link that testing with quick access to care, contact tracing, which is identifying people who had contact with people who are sick, and making sure that they stay isolated or quarantined if they're not sick until they pass their possible window of getting others sick. Those are the key measures for sure.
Lauren, you are expert in emergency medicine, which I learned a long time ago is a process-driven event. You go from step to step to step to step. What part of the testing steps, plural, is the one that's the constraint? What's the thing that makes it so it's so darn hard to get tests done in this pandemic?
I think basically what happened is we had a not so great strategy, and then we executed that strategy in a not so great way, in a poor way. And so we were starting from behind from the get-go. And so now we don't have sort of this systematic approach to testing. It's a patchwork across the United States, and people are making their own decisions. They're working with what they have to get people tested, but it's not systematic, and no one has visibility on the whole system. And so there's breakdowns in where tests are being done, all the pieces that go to it, the reagents, the swabs. There's small breakdowns, and those small breakdowns add up quickly.
Exactly. So I say this with great respect for the exhausted people doing this every day. I hear the clapping in New York City at 7 p.m. It's coast to coast. Great.
Yeah.
Where is CDC in all this? I mean, when I was in school, it was always CDC to the rescue. Shouldn't CDC, with the full force of the Speaker, the Senate Majority Leader, and the President of the United States, affect a uniform test?
I absolutely think so. I think, we're hearing that from the federal leadership that there's enough tests, and that might be the truth. But because they're not spread out and implemented in that systematic manner, it doesn't matter. We need leadership from CDC. We need leadership from Apr. We need leadership from NIH, all supported by the administration to roll out a broad and systematic testing program. Absolutely.
What can we do better in the U.S. to make sure there's enough personal protection equipment?
I think we need to look really hard at our supply chain, and we need to be careful about how we're using PPE closely. And one of the pieces of that is making sure that we don't reopen too quickly, so that we have time to build up our stores of PPE again. We have time to distribute it again before we see another increase in cases if we do open too quickly. So that's key for sure. And then training people to use it effectively and appropriately continues to be really, really important. So as new people come on to work, as new people come into the healthcare system, making sure they understand what it's for, how to use it, and how to be safe while putting it on and off.